Howard University Teaching Hospital here in Washington. Many patients come here suffering from diabetes. It is a serious disease that, if not treated properly, can lead to amputations of limbs, blindness, stroke, and early death. Dr. Gail Bland directs the hospital's Diabetes Treatment Center.
Diabetes is a condition where your body produces too much sugar due to the lack of a chemical called insulin. And with this, it causes you to have symptoms where you urinate a lot or go to the bathroom a lot, drink a lot of water, and you may lose weight. It's a very serious condition if it's not treated and not recognized, and it is becoming more prevalent throughout the world and in the United States.
Why is that?
That's because we are becoming more obese, overweight, more sedentary, and probably the foods that we eat have too many calories in them.
The most widespread form of the disease is called type 2 diabetes. It is partially hereditary. If your parents or grandparents had it, you are at greater risk. But the degree of risk also depends on your lifestyle.
Type 2 diabetes, which is the most common one, where 90% of the people have that one. And that's the one that's really due to when we're overweight. We have a strong family history of diabetes. And this is the one that you can actually treat with pills. And insulin, and of course diet and exercise are all important contributing treatments.
Many patients are prescribed pills to keep their diabetes under control. But eating healthier foods and getting more exercise can play a big role.
We recommend at least 30 minutes, at least 5 days a week, or 150 minutes a week. And it can be just as simple as walking. It doesn't have to be, jogging or doing extraneous exercise. And then cutting back on the food that we eat, and that can mean cutting back 500 calories a day, which could be basically a soda and bag of chips. Those are things that you can cut out of your diet, which can translate into weight loss, which can help manage your diabetes. And in some cases, if you are in that pre-diabetic state, it can prevent you from going on to developing diabetes.
Dr. Bland says that for most, though not all patients, sports are recommended.
Yes. We really recommend that they get physical activity, but there's only a few cases where physical activity may not be indicated. If someone has had diabetes for a long time and they have nerve damage, it may not be a good idea to do physical activity because you wouldn't be able to sense that your feet has lost that sensation, and you may injure your feet, and that may cause problems and infections and may lead to amputation. But in that instance, or if you have heart disease, so I always recommend that you get clearance from your doctor before you take on any kind of sports. But for the most part, we highly recommend that they participate in physical activity.
She says it doesn't matter which sport you play. The important thing is to get off the couch.
We have professional athletes that are diabetics, so they can play any sport, and as long as they get clearance from their doctor that everything is okay, we recommend it.
As living standards and consumption go up in countries like Saudi Arabia, more people are coming down with diabetes. Dr. Bland says there are a number of things health authorities are doing about it.
One is educating the population about what is the cause for diabetes, why we're seeing this increased risk, encouraging people to get more physical activity, eating more vegetables, fruits, less concentrated sweets or highly caloric foods, drinking less juices and sodas. These are all sugary drinks that we can avoid, and these are things that we can do to prevent diabetes or at least control it.
Dr. Bland says some of her patients have gotten healthy enough to get off their pills by simply doing more exercise and eating better. Diabetes is currently the 5th leading cause of death in America, and despite all the public health education, the incidence of diabetes keeps increasing. But doctors say you can reduce your risk of diabetes substantially by exercise and better diet. For Your Life, Your Health, this is Burton Bolag in Washington.